Hey there, and welcome to this explainer. If you or someone you love is navigating the complex and, let's be honest, often overwhelming world of fertility care, I just want to start by acknowledging the sheer emotional weight of that journey. It is absolutely normal to feel this wild mix of hope, exhaustion, and apprehension when you're trying to conceive. Today, we're going to walk through a really effective tool that helps so many people find some much-needed clarity. It's called a Tubal assessment, but you'll usually hear it called an HSG test. Think of our time together today as your gentle, straightforward roadmap to getting the answers you need. We're going to replace that fear of the unknown with solid knowledge and support.
All right, so here's our roadmap for today. We're going to cover the fertility journey, what is an HSG, the step-by-step procedure, finding your answers, and finally, when to wait. Okay, part 1, the fertility journey and seeking answers together.
Moving right along to part 2, what exactly is an HSG? Let's demystify some of that medical jargon. Okay, so let's dive right into this long word, hysterosalpingogram. I know, it is a massive mouthful, right? But if we actually break it apart like a little puzzle, it makes total sense. Hystero just refers to the uterus, salpingo refers to the fallopian tubes, and gram, well, that simply means a picture or a recording. So an HSG is literally just a way for your doctor to take a clear picture of your uterus and fallopian tubes to check for any blockages. Stripped of all that intimidating clinical jargon, it is just a specialized photograph. It gives your care team a completely clear, direct view of your reproductive system.
Now, here's another fancy term you might hear from your clinic, the proliferative phase. So what does that actually mean for you? Well, it's simply the specific window of time right after your menstrual cycle ends. It usually lasts for just a few days, maybe up to a week. And the reason for this very specific timing? It is purely for your safety. It ensures the test is done before ovulation, making absolutely sure that you aren't currently pregnant when the imaging takes place.
Section 3. The step-by-step procedure. Basically, what to actually expect in the room. So, let's see how this builds into 4 gentle, totally manageable steps. First up, just like during a routine smear test, a speculum is inserted into the vagina so the doctor can clearly see your cervix. Second, the cervix is gently cleaned and a very small thin tube, which medical folks call a cannula, is placed just inside. Third, a specialized medical dye softly flows through that cannula right into your uterus and fallopian tubes. Now you might feel a little mild cramping here, kind of similar to period pains, as the fluid enters. And finally, step 4. As the dye flows through, X-ray images are taken. This contrast dye is the magic ingredient that makes your internal structure visible on the X-ray. It lets the doctor see the exact shape of your uterus and make sure those fallopian tubes are wide open. And honestly, just like that, the procedure is complete.
All right, section 4, finding your answers. Let's talk about the medical and emotional payoff here.
So you might be wondering, why take this step on your journey at all? Well, when you're dealing with delayed conception, the uncertainty is often the absolute most exhausting part, isn't it? The primary benefit of an HSG is that it delivers an optimal, highly detailed description of your fallopian tubes. It basically permits your medical team to easily identify any structural abnormalities or tubal blockages. By getting a really clear look at your anatomy, your physician can confidently decide on the absolute best, most effective treatment course moving forward. It completely removes the guesswork from the entire equation. Now, there is an incredible silver lining to this procedure. According to our source material, an HSG may potentially increase pregnancy rates as well. Yeah, you heard that right, no joke. For some individuals, just the simple act of flushing that medical dye through the fallopian tubes can actually clear out minor debris or mucus plugs. So beyond just giving you and your doctor crucial diagnostic answers, the procedure itself can sometimes directly boost your chances of conceiving shortly afterward. It is a wonderful, hopeful added benefit to an already incredibly valuable test.
Section 5. When to wait. Because we always need to prioritize your safety.
So, a crucial point here is understanding these medical boundaries. The test is strictly not recommended if you have certain comorbidities. For instance, if you're currently experiencing pelvic inflammatory disease, the test won't be performed. The exact same goes for an active pregnancy, which, as we mentioned earlier, is exactly why timing the test right after your cycle is so absolutely critical. Additionally, if you have severe endometriosis, which is a condition where tissue similar to the lining of the uterus grows outside of it, your doctor might actually opt for a different approach. The reason is that the dye could potentially irritate those conditions. Really, this careful screening just proves that your doctor is looking out for your holistic health, making sure the right test is done at the safest possible time for your body.
So, are you ready to find your answers? An HSG test is truly an empowering tool. It isn't just some clinical procedure, it's a bridge to clarity. It helps you and your physician unlock those crucial next steps in your care. By demystifying the medical jargon and walking through the process together today, I really hope this explainer has replaced any anxiety you might have had with some solid reassurance. You are taking active, positive steps toward your future. Please remember to be gentle with yourself during this process. And as you prepare for this next step, I want to leave you with this thought. What other areas of your fertility journey could be completely transformed by simply shedding light on the unknown? Thank you so much for joining me today, and remember, your answers are out there.